Hello everyone. We are Pia, Pete, Dario, Just, and Nina from Group2C and will present you our case study and treatment plan for the patient Gary. First of all, we are going to tell you something about Gary's problem and his symptoms we retrieved from the case description and the conducted interview. Then we will give a short description of Gary's diagnosis. After that, his strengths will be presented and ultimately the intervention and treatment plan we formulated for Gary.
Problem analysis. Gary is a 63-year-old man with a love for gardening as well as football. In recent years he developed mobility problems which frustrates him greatly, especially because they restrict his ability to perform his favorite activities. This frustration caused Gary to start drinking heavily, as it helps him cope with the emotional stress, as well as assist against the pain his condition causes. His wife Helen is greatly worried about him. However, Gary starts to get angry to the point of verbally abusing her when she raises the issue. Although he is unable to express it to his wife, he privately confessed being scared at the thought of losing Helen because of his alcohol abuse. He is afraid of what his increasing disabilities, as well as the alcohol do to him, and he wants to quit to save his marriage.
Now we are continuing with Gary's diagnosis. As the focus of this presentation lies on the treatment plan, we will only shortly talk about his specific symptoms and will restrict ourselves to Gary's overall diagnosis according to DSM-5. According to the case description, Gary could fulfill 2 criteria. If you go by this, Gary would have a mild alcohol use disorder. During the interview we conducted with him, we were able to gather more detailed information about Gary. In the end, another 3 criteria could be met. After analyzing the case description and the interview, we were able to come to a diagnosis of a moderate alcohol use disorder. Hereby, it is important to note that alcohol use disorders are highly comorbid with anxiety and depression, which requires further screening. As a small orientation of Gary's symptoms, we have listed 3. These are Gary's loss of interest in activities, emerging difficulties with family and friends due to Gary's alcohol use. Furthermore, Gary suffers from mild withdrawal symptoms when he has not consumed alcohol for a certain period of time.
In order to be able to motivate Gary to participate in the treatment plan, Gary filled out the VIA Strengths questionnaire. According to the VIA, Gary's top 5 strengths are love, forgiveness, fairness, creativity, and zest. As a group, we decided on using the 3 strengths love, forgiveness, and zest to establish the treatment plan. The capacity to love is in strong correlation with life satisfaction and general well-being. His love regarding his wife Helen can be motivated to get Gary to participate in the treatment plan. The character strength of forgiveness is defined as a conscious release of feelings of resentment and decreasing negative feelings. For the treatment plan, Gary needs to forgive himself for treating his wife unfairly, therefore the focus is set on self-forgiveness. People who have zest are prone to being excited and flourishing about life and show enthusiastic behavior for new things. Because he is not able to work in his own garden, which he is very passionate about due to his back pain, he experienced unhappiness. It could be beneficial to bring out this character strength again to support Gary back into a content life.
Goals. 3 relevant goals were chosen for Gary in accordance with the SMART criteria, which you should all be familiar with. They also had to be easy to understand in order to make Gary's first steps towards sobriety as easy as possible. These goals were the basis to create the intervention, however extensive elaboration on how one led to the other is not necessary. As you will see, their connection will become immediately obvious through their overlapping aspects once we explain the intervention. The first goal we chose is Gary spends 3 hours with his wife for at least 2 evenings a week and engages in activities such as going for walks, playing cards, or cooking with her, based on the strength love. The second one is Gary writes down 3 things for which he is grateful every day in the evening for 6 weeks, based on zest. The last one is Gary attends motivation enhancement therapy 2 times a week, based on forgiveness, or specifically self-forgiveness.
The next part deals with the chosen interventions according to Gary's needs and his strength. The first one is activity with Helen. This intervention has the purpose that Gary spends more time with his wife Helen because she's the reason why he wants to change his drinking behavior. This includes that Gary is sober. The chosen activities are new things like playing cards or things Gary enjoys doing, like watching football games. It is not possible to engage in any activities that involve physical activities, as Gary is not able to move due to his condition. This was chosen because partners have a positive influence on drinking behavior and can help in the treatment of substance use disorders, as 60% decreased their drinking behavior if their partners were involved. This intervention is in line with 2 of Gary's top 5 strengths. These are zest, as Gary loves to engage in activities and is very enthusiastic, and moreover, love, as this intervention includes Helen, his reason to stop drinking. Now the gratitude journal. This widely used and evidence-based intervention in line with a positive psychological approach. The idea is to write down 3 things you are grateful for at the end of the day. The best way to do this is to do it every day. This creates awareness for the positive things in life and helps to deal with the negative emotions and events in life. Moreover, this intervention increases satisfaction in life and happiness and can help to transfer negative emotions into positive emotions. Furthermore, it helps to get a structure in life which many people lack that suffer from substance use disorder.
I am now going to continue with the Alcoholics Anonymous part. Here, Gary is encouraged to attend Alcoholics Anonymous meetings once a week, where he sits together with people who want to quit alcohol or have already done so. That is because research has found that Alcoholics Anonymous is effective to encourage people that abuse alcohol into quitting. The meetings help create new friendships and bonds, which ultimately create an environment that does not facilitate Gary's drinking behavior. This is in line with his strength love, which may help to maintain healthy relationships. Furthermore, by hearing about the stories and experiences of others, Gary is encouraged to learn from them and not repeat their mistakes. Additionally, accountability is encouraged, since Gary is going to meet people that truly understand him because they can better understand his experiences. This corresponds to his strength, forgiveness. Forgiveness can be used by Gary to forgive himself as well as other members who engaged in similar activities. Now we go on to motivational enhancement therapy. Here, Gary is presented with multiple different motivational strategies which Gary can use to change his drinking behavior. According to research, 50% of those who attend motivational enhancement therapy report a decrease in drinking and alcohol intake 12 months after the intervention. The focus of this therapy lies on motivating the client to change his drinking habits through his own motivations. It does so by presenting the advantages of remaining sober and the current disadvantages of his drinking habits. Ultimately, an individual treatment plan is created for Gary. Thank you very much for your attention and feel free to ask questions.